So let's talk about scabies because I've seen a lot of cases this past few weeks of scabies, and a lot of times this will happen after people have been traveling for, say, the holidays or spending time with family, close quarters where you might be exposed. Scabies is a term applied to an infestation of human skin with a mite that burrows into the skin and completes out its life cycle by laying its eggs and hatching more mites. It tends to prefer the superficial layers of the skin called the stratum corneum. Scabies is generally spread person to person or infested surface to person based on the scenario you might be in. It generally requires prolonged contact with those surfaces or those people that might be infested with scabies. It's not generally thought to be transmitted through a simple handshake or a hug. It would usually require prolonged contact. In my practice, in 20 years of seeing so many patients with scabies, I'd say a scenario that might play out is it's possible to manifest scabies after, say, prolonged contact with a couch that might be in somebody's home who has scabies. The majority of cases I've seen in my practice are from prolonged contact. I've seen it break out in dormitories, for example, but usually between the students, they're spending more time in each other's rooms, say on a couch or a surface that might be infested with those mites, or spending time with an individual who might be infested with those mites. The hard part for scabies is that there is a delay between the exposure, the point of contact, and the time that you might manifest symptoms. As a matter of fact, within the first few days of an exposure, you might not feel anything. You might not even know it happened. Maybe a little itching here or there, but nothing so significant that you might think that you were exposed to the mite. The symptoms of an itching can be delayed by 4 to 8 weeks, which is about a month or two later, which requires us to have a little investigative work to kind of mentally go back in time to figure out where that point of contact might have been and why your symptoms are now manifesting. A lot of times people will misattribute their symptoms of itching to some other source or cause and not realize that it was a point of contact that might have led to these symptoms. Scabies tends to manifest as intensely itching papules that get scabby and crusty. We call them linear burrows because it's almost as though the mite is burrowing under the skin to deposit its egg under the surface. People generally start to feel intensely itchy and an itch that's hard to control. More often than not, when I've seen a patient with scabies, they've already been to their primary care doctor or an urgent care, and they've actually probably already had a course of steroids for a presumptive case of contact dermatitis or something allergic in cause. Those patients will classically say that maybe there's a little help with itching, but not much, but ultimately their itch is still there and they're still not quite clear on why. Although it's true that you can diagnose scabies through scraping the skin and skin biopsies, in my practice, I can't say that you often have to do that. It has a very classic presentation that when you've seen enough cases of this, it can be diagnosed clinically. Early on in an exposure, sometimes even the yield of a skin scraping or a biopsy might be pretty low. And the challenge is you don't want to be sent down the wrong path in terms of a diagnosis. You don't want to delay diagnosis and treatment based on that low yield of a skin scraping or a biopsy, especially early on in the course of the infestation. A lot of times if there isn't a volume of scabies on the skin to manifest in a biopsy or skin scraping, there might be an assumption that there's some other trigger or cause, and we want to make sure that we treat this as early as possible to avoid further spread. Treating scabies requires a multi-pronged approach because we have to treat the individual, we have to treat their points of contact, and we have to treat their environment. To treat the individual, we do have a variety of options ranging from oral medications as well as topical therapeutics that are available to us. They all work well, they are effective. Sometimes it can take repeated treatments of different versions of medications out there, depending on what's available to you, but overall very treatable. The caveat though is that treatment is only successful if we avoid a re-exposure. So we have to consider treating the household members and close contacts, because if we don't, and they still have the scabies or evidence of scabies, or they don't even know they have scabies yet, there is a chance that you can get re-exposed pretty quickly, and we end up chasing our tail trying to get results because you're just getting re-exposed and treated, re-exposed and treated. I tend to recommend that close contacts and family members come in to be evaluated and treated. I also recommend that everyone treat simultaneously, so this should be a planned approach where you're not treating on a Monday and then your family member on a Tuesday. If Ideally, everyone can do this at the same time and plan this out. Then we have a much better success rate of reducing the overall exposure to scabies in one moment in time and then staying on top of this. Otherwise, we might find ourselves in this back and forth scenario again. And then the next step is also treating the environment. The first thing to bear in mind before treating your environment is to recognize some basic principles of scabies. One of the things that we have to our advantage when it comes to scabies is that it cannot live off of the human body for longer than 72 hours. This gives us the ability to say we don't have to clean the whole environment. We just have to make sure we avoid contact with certain points of our home for 72 hours. So I classically will tell patients you don't have to go home and clean out everything in your closets or your linen closets or the same scenarios that we might see with bed bugs. Not at all. I would actually say why not just close the door of those areas so that you don't have contact with your linen closet, with your closet for a period of 3 days, and then you can actually re-expose yourself once you know that you're clear of scabies. Designate the time and day to start the treatment course. For many people, this could be a Friday, knowing that you've got Friday, Saturday, and Sunday to really attack this, and you can get your 72 hours in to really ensure best results. Once you've completed out one course of treatment, depending on which one you've done, you're thought to be at the very least less contagious for a period of 24 hours, only because most of the medications that are used to treat scabies will at least kill off the live mites. What we're really focused on next are any eggs that haven't hatched so that we can stop the life cycle from progressing forward. Any bed sheets that you slept on that night should be laundered or washed, and try to reuse those exact same bed sheets from that point for the next week as you complete out your course of therapy. Any bed sheets, linens, or towels that have not been used, please keep them in a cabinet for a period of 72 hours and not come into contact with them, just to ensure that any possibility that scabies might have been present should be reduced so that you don't have to worry about a re-exposure amongst those items, and hopefully you won't have to consider re-cleaning those items as well. Try to designate areas of your home to reside for that period of 72 hours to avoid spreading contact to different areas that you might have to address later. So I tend to find that the bedroom might be the easiest place. Living rooms, family rooms that might have upholstered furniture, try to reduce your contact with those areas as well, just so that you don't have to clean and worry about those areas down the road. If you can just focus on a certain location in your home, then you can limit your need to address other areas. Also remember to treat or address your car, because sometimes this has come up where the car could be a source of re-exposure. One study out there did demonstrate that antiseptics such as hand sanitizers were not effective against scabies. The scabies are microscopic. They burrow under the skin. You cannot see them with the naked eye. We see them under a microscope. We don't know if they can make it through things like bed bug covers and dust mite covers that are used to protect mattresses. So really focusing on that life cycle of the critter and trying to use that to your advantage is a much better approach than trying to figure out ways to block your exposure to it. Even things like Clorox bleach, for example, if you look at the microbes that it's designed to address, scabies isn't technically on that list. Doesn't mean it's not effective, it just means it hasn't been tested in that capacity. The other thing to remember with scabies that we do know based on some studies is it's not thought to be able to survive greater than 50 degrees Celsius or 122 degrees Fahrenheit. So this means laundering can be done at hot temperatures to reduce that chance that scabies survives the laundering process. Scabies is not thought to transmit disease. It only lives in the superficial layers of skin. There is no vascular supply to that region. So the real issue with scabies in terms of disease is the process of itching or scratching your skin can expose your skin to bacteria from the environment that can secondarily infect those areas. Yes, you can get infected from overly scratching the area, so our goal is symptomatic relief while we're trying to get through this period of time. The hardest part for many of my scabies patients is that they still continue to itch for up to 4 weeks afterwards, and sometimes a little longer. And it can be really hard for them to gauge or understand whether or not they've been successful in treating their environment. The key that I found for most of my patients, though, is that once they've treated, they do find a sudden drop in the intensity or severity of their symptoms.